it is overwhelming. As Dr. Simone said, mesothelioma still remains, it's still considered an incurable disease. So it's not like there's a penicillin for this, and so there isn't an answer. You have mesothelioma, you do this, which is exactly why we started this program. And so the Penn-Mesothelioma and Pleural program was designed to make it easy for the patients, and you can see we barely get along. So there's a lot of fighting. But let me just tell you what happens when of course, I mean, I'm always right, but that aside, but when the surgeon is always right. That's the premise of the whole program. No, I mean, in fact, what happens is a patient, we have a patient navigator, nurse navigator. Patients contact the program. We review all of their information at a conference that we get together every Wednesday. I must say, when Dr. Sturman and I started this program, we thought we'd be meeting once a month. We now meet every week, and sometimes we have to extend the hours just to cover everything. But what happens is a patient has all of their clinical information reviewed, and we sit and talk amongst our group, and there's 4 of us here today, but there's usually 15 to 20 people at the conference, and everybody has equal weight. Everyone has a voice, and everyone talks about what the potential options are for this patient. So is surgery a potential option? Is immunotherapy an option? Chemotherapy, radiation? What are the different things we can do for this patient? And then what happens is we go down, the patients, the same morning, while it's still fresh in everyone's mind, the patients are put down in our clinic with their families, and each of us comes through and talks to the patient, and we present them with the options. So when I go and see someone about surgery, I go through all the things that can happen. So, you can die having surgery. You can have the surgery, everything goes fine, and the cancer comes back like we were never there. That can happen with any cancer. That can happen with a lung cancer the size of a pea, which should be a 90% cure rate. Or something can happen, and we will impact your survival beyond what we would expect with other treatments. And because of the lung sparing, it would be our expectation it would be with a good quality of life. But we don't know what's going to happen. So when I conclude my visit with the patients, it's typically with something along the lines of, if you want to do surgery, the reason to do it is it seems to help some patients beyond what we would expect with other things, but we don't know, at least with surgery. And so if you don't want to do surgery, understanding all that, I would be the last guy to argue with you. And what we all tell the patients is keep an open mind, listen to everyone, see what all the treatments are, ask your questions, and then make your decision. And we don't expect people to make a decision that day. But that's all this sort of, there's immunotherapy, all these different modalities, and it's important to know that we are working together, and it is a concerted effort, even though it may seem overwhelming with all the different things that are going on. We are working together to offer patients what are coherent options from which they can choose.